Hi, my name's Alayne Markland, and I'll be narrating a special talk put on by the National Association for Continence for Bladder Health Week on falls prevention and safe toileting. Everyone and anyone can be affected by falls. Here are some examples from modern times of people who have fallen in the last decade or two. Currently, the United States Center of Disease Control has budgeted over $2 million per year to prevent falls among older adults. Yet, this is a serious problem that costs more than $28 billion in direct medical costs from both fatal and non-fatal injuries every year. For people over the age of 70, the average health care cost of a fall injury totaled almost $20,000, excluding doctor fees, in 2010. By the year 2020, the estimated annual cost for fall-related injuries for people aged 65 and older is expected to reach $43.8 billion. Nationally, September has been designated as Falls Prevention Month. The first day of fall occurs every year on September 22nd, also a day when passionate people across the country stand together to observe the annual National Falls Awareness Day sponsored by the NCOA. Falls risk prevention means making the home or living environment as safe as possible for a parent, grandparent, or older adult. 36 states will participate, joining over 70 national organizations, professional associations, and federal agencies that comprise the Falls Free Initiative to raise awareness through educational presentations, risk screening activities, and other outreach strategies. They are all standing together to bring attention to a common sense, effective strategy to help older adults reduce the risk of falling. The National Council on Aging, NCOA, a long-standing collaborative partner of the National Association for Continence, NAAFC, promotes proven programs for seniors to stop falls before they even start. Their vision is for older adults to have fewer falls and fall-related injuries, maximizing their independence and quality of life. In addition to a general review of these issues, this initiative includes discussions of implications and recommendations across 4 primary risk factors. These include physical mobility, medications management, home safety, and environmental safety. The goal of physical mobility includes that all older adults will have knowledge of and access to effective programs and services that preserve or improve their physical mobility and lower the risk of falls. Also, that healthcare and other service providers will be more aware of and actively promote these strategies and community resources. Risk factors that predispose older adults to falls include lower extremity weakness, such as peripheral neuropathy, generalized deconditioning and poor endurance, musculoskeletal stiffness and rigidity, like in Parkinson's disease, and slow reaction time to alarms and balance and slow walking speed. The presence of these risk factors in older adults with chronic medical problems leaves them at a much greater risk for fall-related injuries because of their limited reserves and their fragility. It is clear that exercise and physical therapy can be effective means to help reduce falls and falls-related injuries in older adults. Here are some measures to improve mobility and reduce falls. These include regular exercise, if needed, the use of a cane that's properly sized and adjusted to someone's body height, physical therapy, especially exercises with stretching and balance, properly fitted shoes, having good foot hygiene and foot protection, and having good eyesight. Another big risk factor includes taking over 4 medications. These medications specifically include those medications that may cause alterations in blood pressure, such as diuretics, and those medications with a sudden drop in blood pressure when standing from a reclining position. In addition, drugs with anticholinergic side effects are commonly associated with falls due to the side effects. These anticholinergic medications can contribute to falls by causing blurred vision, drowsiness, sedation, confusion, disorientation, dizziness, weakness, hallucinations, and delirium. These are the drugs, the anticholinergic medications, that are commonly used to treat urinary frequency and incontinence. We do know that taking more than one medication with an anticholinergic effect does increase the risk and severity of the fall. All older persons should be advised that these medications may increase the fall risk, and prevention and management may need to be assessed appropriately. The goal of medication management includes that all older adults will become aware that falling is a common adverse effect of some prescription and even non-prescription medications, and bring this up to discuss this with their healthcare providers. Healthcare providers should adopt a standard of care that balances the benefits and harms of these medications in older adults. In addition, changes in cognitive and physical function, dizziness or lightheadedness, balance difficulties, confusion, as well as sedations should alert caregivers as well as health and aging providers to refer older adults who experience these problems to specialty health professionals for a comprehensive assessment. Medications can cause these changes and require interventions aimed at medication modification to help reduce the risk of falls. These modifications might include dosage reduction, the elimination of particular medications, or even use of an alternate medication. Increasing evidence supports the use of vitamin D with or without calcium to help reduce the risk of fall and fracture rate in older adults. This approach is interesting because of its simple application and low cost. However, published studies have shown conflicting results because some studies failed to show any effect while others report a significant decrease in risk of falls and fractures. In looking at a recent 15-year literature review on the mechanism of falls in older adults, researchers reported that vitamin D may actually have some effect on the postural adaptations, such as the muscles and central nervous system, which may explain the decreased risk of fall and bone fracture rates, and the underlying the reasons for differences and controversies between published data. Vitamin D supplementation may be integrated into primary and secondary fall prevention strategies in older adults based on some of this body of data. The goal of home safety includes that all older adults will have knowledge of and access to home safety measures. These home safety measures include information, proper assessment, and home modifications that reduce home hazards, thus improving independent functioning and lowering the risk of falls. The majority, at least 55% of all injuries among older people occurred inside the home. An additional 23% of injuries occur outside but near the home. The home environment itself is implicated in more than one-third of older persons' falls. Consequently, elimination of hazardous conditions such as clutter and poor lighting, and the addition of supportive features such as grab bars and handrails placed in specialized locations such as stairs and bathrooms are both important strategies in falls prevention. In addition to the home safety, environmental safety includes access to community environments that lower the risk of falls and facilitate full participation, mobility, and independent functioning in a community setting. Falls in the community can occur in both public and private outdoor spaces as well as in buildings. Outdoor community hazards include uneven pavement surfaces, pavement cracks, tree roots, slippery walking surfaces, obstacles and walkways, snow or ice or weather-related conditions, uneven steps, floor mats, door sills, unsafe stair design, and poor lighting. Hazards in the built environment, such as in buildings, include poorly maintained buildings, lack of safety features such as handrails, grab bars, curb cuts, and ramps, and inadequate lighting and glare from surfaces. Eliminating these hazards in existing settings and designing new communities with fall prevention in mind are strategies that could really help the older adult. Why would all of this matter? We know that every 15 seconds, an older adult is seen in an emergency department setting somewhere across our nation for a fall-related injury. Every 29 minutes, an older adult dies following a fall. Unintentional injury is the fifth leading cause of death in those aged 65 and older, and 2/3 of all injuries are related to falls. According to the CDC, traumatic brain injuries resulting from falls caused roughly 8,000 deaths and 56,000 hospitalizations in the past 3 years. The risk of women suffering from falls and fractures related to those falls is alarming, with nearly 72% of seniors admitted to hospitals for hip fractures being women. Those who fall 3 or 4 times a year are most likely to be admitted to a long-term care facility with permanent disabilities, while men who fall are more likely to die as a result. Many older adults who fall never go home again, and are placed in care facilities, and many are relegated to a wheelchair for the remainder of his or her life. Those numbers, coupled with the number of fall risk hazards found in the common home, result in thousands of hospitalizations every year. So who do falls affect? They affect 1/3 of people over the age of 65 each year, and 50% of those are over the age of 80. 5% of older people who also may actually require hospitalization due to their fall. Many people are at increased risk for falls, and these include pregnant women, individuals with peripheral neuropathy, mental illnesses, and Parkinson's disease. It is vitally important to understand the impact of falls because of the morbidity and mortality related to falls in the older adult. Many people may fall, but also suffer a fear of falling that can lead to their loss of independence. The connection between falling and using the toilet. We do know that both older men and women with both moderate or severe lower urinary tract symptoms, such as urinary frequency, urgency, with or without incontinence, are at significantly greater risk for falls, and the risk dramatically increases as symptoms worsen. These symptoms include urinary urgency, frequency, and the need to strain to sometimes initiate urination because of bladder outlet blockage, especially in men. Older women are more likely to experience urge incontinence than men, but as men approach older age, such as the 8th decade or age 80, they also become equally as likely to experience urgency and frequency and incontinence, if not more so due to an enlarged prostate that may impede the flow of urine. So they are rushing to the toilet or trying to find a toilet in public, and thus are very vulnerable to falls, not only in the public but also at home. And even if they don't lose urine on the way to the toilet or urinal, that urinary frequency is an additional risk factor. So for anybody with urinary problems and also gait or mobility problems, you really need to get evaluated and diagnosed for proper control. Proper evaluation. So if you have both a gait or balance problem, you may need to be evaluated by a specialist who can look at all angles of the problem. This may include an occupational therapist or a physical therapist. You may also need to have a referral from your primary care physician to go see a therapist in the community, or perhaps a therapist can come to the home and do a home evaluation. This is very dependent on your health insurance plan. You should also evaluate your home for any environmental hazards. This can be done through the means I've mentioned before, through a home safety evaluation, or even a home safety evaluation checklist that is available online to download. And you can have a safety evaluation done in the home by someone who is licensed to do this sort of evaluation. There are many effective measures and precautions you can take to reduce the risk of falls. Some include when getting out of bed, sit on the edge of the bed for a few minutes before standing to make sure that your dizziness is dissipated or stopped before you stand or rise to a standing position. Also, keep the path to the bathroom clear of clutter. An additional measure would be to wear slippers or avoid stepping on mats or things you can trip over in the evening or while getting up to urinate or getting up to take medications in the evening. So wear slippers with non-skid soles. In addition, it is very important to take time to turn on the lights, potentially even keeping a light on, or having access to a working flashlight at the bedside can be a very helpful addition to having to get up in the evenings when it's very dark outside. In addition, both frail and older individuals with the multiple risk factors for falling that I've talked to may benefit from a bedside commode if mobility is a significant problem. Other measures that have been evaluated for fall prevention include that most falls occur in the bathroom and the kitchen area of the home. So to make the practice of toileting safer, you should allow plenty of time to get to the toilet and use the toilet. Try a regular schedule to go to the bathroom, especially during the day. Try to urinate every 2 hours, and often before and after meals. If getting up at night to empty your bladder is a problem, try limiting evening fluids at least 2 hours before bedtime. In addition, we recommend avoiding caffeinated, carbonated, or alcoholic drinks, especially in the evening. If needed, a urinal, a bedside commode, or bedpan can help reduce trips at night to the bathroom and may help eliminate some of the problems with mobility and falls. These should be considered and kept nearby as an option. You should also consider wearing clothes that are easily accessible to get on or off or open and get out of the way to use the toilet. Lastly, once you do make it to the toilet, you would want to remain on the toilet until your bladder is empty. If you still feel as though there's a need to urinate, stand up and you may consider sitting back down again to reinitiate a urinary stream. If you fear you may need assistance for safer transit to and from the bathroom, there are several aids that can help summon help from a friend or family member in the vicinity. These aids include a small handheld bell, which may be a simple option that's not costly. You just would need to make sure it rings loud enough for someone else around the house to hear. Another option is a purse alarm that can be clipped to clothing or the toilet itself. It can sound an alarm when you try to get up from the toilet seat. For remodeling recommendations or constructing a new home, you should seek out a specialist certified by the National Association of Home Builders in aging-in-place designs and residential construction. In addition, commode frames make it easier to sit down and get up from the toilet. Often raised toilet seats may help with mobility problems. A lift commode chair can also help a person who is very immobile or with mobility problems get up from the toilet, and it can also help a caregiver if caregiving help is needed with lifting. In addition, a 3-in-1 bedside commode that converts to a toilet with a raised toilet seat or shower chair is another option. Rubber mats or specially placed mats may also help with uneven surfaces. In conclusion, I'd like to mention that falls are never to be taken lightly, and they can lead to serious injuries and even death in certain situations. Please keep in mind that falls prevention is really important when toileting or going to the bathroom, since this is the location where the majority of falls do occur. So with that, I'd like to conclude the session and entertain any questions related to falls and falls related to toileting.